Okay, so I'm starting, we're just recording this. So the internal responsibility system is a system that where workers and employers are the best placed in the workplace to solve occupational health and safety problems. And at any time, if there's any enforcement issues, either the workers or employers can access the Ministry of Labor. This philosophy is what the Act was founded on. I'm just going to so for the IRS to be effective, supervisors, workers, and other workplace parties, they need to have practical knowledge, training, and skills to control workplace hazards. A component of the internal responsibility system is a functioning committee that is identifying hazards and making recommendations to improve workplace conditions with the goal of preventing accidents, illnesses, and lost time injuries. And the key to all this is that if any one of the workplace parties is not fulfilling their duty, the IRS is not working. So that is the way it is currently set up in the Act, is that there are many overlapping responsibilities of the employers, of the workers, and of supervisors. And above that is a joint health and safety committee to ensure that as those parties are fulfilling their duties, that there is a system in place to ensure that hazards are constantly being identified and that recommendations are taking place. So now we're going to look at some of the duties of what are the duties under the Act as it relates to workers, supervisors, and employers.
So duties of the employer under the Occupational Health and Safety Act can be found under Section 25 and 26. And while we are going to go through some key ones that we feel will be very useful to highlight for you folks, this is not the complete list of duties that the employer has. So ensure that the prescribed protective equipment, materials, and devices are provided in good condition and used in the workplace. This, as when we talk about prescribed PPE, some of you folks, most of you folks, I shouldn't say all of you though, do fall under the Healthcare and Residential Facilities Act. And within that, it talks about what does that good condition look like in terms of equipment, PPE, and things of that sort. To ensure the measure, procedure, and training as prescribed are carried out in the workplace. To provide training and information about the hazard of the work, right? And we can see that this is definitely relevant in this time to making sure that you folks understand what are the hazards that come with COVID-19 and what is the training that you need in order to navigate through that hazard and the information to do that safely. Also appoint supervisors who are familiar with the work, aware of the hazard in the workplace, and familiar with the Act. And later on, we'll highlight what their obligations are too. The employer must prepare written policies for occupational health and safety, violence, and harassment, and develop programs to implement these policies. So it's not something that should just be created and printed on a piece of paper and nobody looks at it or cares about it, but something that also is going to actually roll out in the workplace. And these might be written policies like infection control policies, pandemic plans, that you in terms of what it relates to COVID-19 today. Afford assistance and cooperation to health and safety representatives or committee in carrying out their duties and rights under the Act, right? So making sure that the health and safety committee and or representatives are getting that information and kind of more of a collaborative effort if they need tools or information in order to carry out the duties under the Act, which we will later speak more to. And provide health and safety representatives or committee the results of reports respecting occupational health and safety that is in the employer's possession. So this is a great piece of clause that can be used to try and get various reports like incident reports, near misses, WSIB reports, and things of that nature in order to help the committee or the representative carry out the work and the duties. Notice of accidents, incidents of workplace violence and occupational illness. So they must provide a written notice that is provided to the health and safety representative or health and safety committee and the union in the event of an accident or incident of the workplace violence that requires medical attention or disables a worker from their usual work, and a worker who has suffered an occupational illness or has filed a claim of occupational illness with WSIB. And the notice to which you folks should receive this report would be within 4 days of the occurrence. So I'm sure you folks have seen from many of your staff reps and some of the memos and Q&As that CUPE has on their website that we are encouraging you folks to fill out exposure forms when it comes to COVID-19 if that is the case, and to also fill out WSIB claims, because that will allow the committee to get that report and be able to do the work that is so important in the workplace. Then we go on to duties of the supervisors. Again, under the Act, this is Section 27, and there are other duties, but again, for the purposes of this webinar, we want to highlight these. So they must work in compliance with the Act and the regulations. They must ensure that workers wear any protective equipment required by the employer to be worn. Ensure that safety and procedures established by the employer or the regulation is carried out within the workplace, and to acquaint any worker with the hazards in the workplace to which they are aware of. And now we move on to duties of the workers. So this can be found under Section 28. And unlike the employer and supervisors, the list is a little bit more shorter. So to also work in compliance with the Act and the regulation, to use or wear equipment, protective devices, or clothing that the employer requires to be used of worn. So just to highlight that is with the understanding that the use or the wear of the equipment, protective devices, or clothing that the employer requires you to wear does not cause another hazard to you, is comfortable, and is good condition, as I mentioned earlier. Report to the supervisor the absence of any protective device, any defective equipment, or any contravene of the Act that is likely to endanger a worker, and not remove or make ineffective, any protective device or operate any equipment, device, or machinery that may endanger themselves or another worker. And those two last points are really important for you folks as Health and Safety Committee members and as reps to make sure that at the end of the day, you folks are all workers, right? And you do have duties under the Act that you should be reporting to your supervisor and making sure that they deal with the hazards in the workplace when you bring that to their attention. And now we're going to talk about joint health and safety committees and health and safety representatives and the powers, rights, and functions that you folks have.
So thank you, Felicia. So as we've learned in the last few slides is that thinking about getting back to that internal responsibility system, we see that it's a shared responsibility for worker health and safety, for just occupational health and safety in general in the workplace, but it's not an equal responsibility. We see that the employers and the supervisors hold a greater responsibility in the workplace when it comes to just ensuring that those particular duties and health and safety measures are carried out and that the work environment is safe. Now, this would be fine and we could leave it at that, but we also need some kind of mechanism in place that will ensure that it is ongoing, that the work environment is constantly being assessed and determined whether or not there are hazards, and to ensure that workers are at the end of the day protected from accidents, illnesses, or injuries. So this is why we have joint health and safety committees and health and safety representatives. And we're going to quickly go over, do a review of what are the powers, duties, rights, and the roles of the joint health and safety committee. So we have to understand the difference between a health and safety representative and a joint health and safety committee first. So a health and safety representative is required at a workplace where between 5 and 19 workers are regularly employed. And you can find that in Section 8 of the Occupational Health and Safety Act. A joint health and safety committee is required at a workplace where 20 or more workers are regularly employed, and you can find that under Section 9. But it's important to remember that both the health and safety representative and the joint health and safety committee have similar powers and functions under the Act, except just that the committee will have meetings. But the essential roles of the committee and the health and safety representative are to identify situations or conditions that are a hazard to workers, obtain information from an employer concerning hazards, processes, and equipment, and making recommendations to improve workplace conditions. So the question I have for you to think about is this the role that the Joint Health and Safety Committee is currently occupying in your workplace? Is there a identifying of hazards? Is it ongoing? Are you obtaining information about those hazards from your employer? And are you making recommendations to improve workplace conditions? So with COVID-19, it's been something that's been new. It's demanded a lot more. Complex problem solvings of how to protect workers. But at the end of the day, it's a hazard, and we must treat it as a hazard. And it doesn't change how we apply health and safety laws and principles. So are we identifying the situations to which workers are being exposed to COVID-19? Are we finding out as much information about it so that the committee can do their role to make recommendations to improve whatever currently is in place? So we'll quickly touch on the difference between a multi-site and a single-site committees, because some of you might have either one. So where so permitted, a multi-site committee may be established, and it's usually by an order of the Ministry of Labor. And in the case of a multi-site, one committee can be established for several workplaces under the same employer, instead of having a single committee at each site that the employer has. And you would see that normally in a few agencies. You would see that within community living as well. And you would see that also within certain DSAB as well. But it doesn't matter as far as if you have one committee for all the different workplaces or a committee at each workplace. The multi-site committee members have the same rights and duties of a regular joint health and safety committee. But it's important that if you do have a multi-site, that terms of reference are signed by both parties and approved by the Ministry of Labor. And those terms of reference will set out how inspections are done, what is quorum, what is the structure of the committee, what is the composition of the committee. So as long as those terms of reference are greater than the minimum standards under the Act, that'll be approved by the Ministry of Labor. One of the key duties or roles of a committee is inspections. So we're just going to run through a lot of the minimum standards. You might have different standards within your terms of reference or health and safety agreement or your collective agreement language, but just remember to remind ourselves what are those minimum standards so we can always improve upon them. So for inspections, every workplace shall be inspected by a designated worker member of the committee every month, and annual inspections are only allowed with ministry approval, or it might be set out in some terms of reference, but it's very rarely ever granted. Now, the Act says that the physical condition of the workplace can be inspected. However, there is nothing stopping workers from talking with other workers or thumbing through health and safety related documents. So don't limit your inspection to looking at just trip hazards or safety hazards, or you want to look at other kinds of hazards and other kinds of documents which should be included. Make sure your training policies are all up to date. Make sure that your training records are up to date. Those things can be incorporated into a monthly inspection. Now, a management representative of the committee may accompany the worker representative during that inspection, but the inspection is the worker's inspection. And sometimes it's either a good thing or a bad thing to have a management representative accompany you during that inspection. If they are there to assist and provide cooperation in your inspection and to find out really what are the hazards you are identifying, that's a good thing. However, if they're just there to argue points about what is a hazard, what isn't a hazard, and asking you to erase things on your inspection and say, oh no, well, don't worry about that. We'll take care of that later, or things like that nature, then that is not providing assistance and cooperation to a committee member in the exercise of their duties. When it comes to meetings, the Act says that the committee must meet at least every 3 months. Some of you might be meeting every month, which is great, but meetings have no fixed time limit. Very often I hear that, we're only given 4 hours to do our meeting, but we have all these outstanding items left on the agenda. Well, if you still have outstanding items left on the agenda, the meeting should continue either the next day or you set a date for the meeting to continue. There is no fixed time limit, and it's important that the committee get through all their agenda items and have good discussions. If not, I would say your IRS is not working if you're not able to get through all your agenda items and the meetings are on a strict time limit. So quorum, there's nothing in the Act that speaks to quorum, and it's usually established by the terms of reference or health and safety agreement. But it is important to note that at no time will the number of management representatives exceed the number of worker representatives on the committee, and at a meeting as well. Now, minutes must be taken and conserved in case an inspector wishes to review them. And voting is generally not recommended. We want issues to be resolved through consensus. That is how a committee can really have good discussions and to make sure that both parties understand the issue and discuss all the options that are available before making those recommendations, rather than just forcing people to vote on a particular issue. For co-chairs, every committee shall have 2 co-chairs, one co-chair that is from the management, selected by management, and one co-chair from workers, selected by the workers on the committee. And some of the co-chair duties include chairing meetings and alternates, preparing the agenda, signing minutes, approve guests to attend meetings. And either co-chair, this is important, has the power to put forth a recommendation if the committee has, in good faith, failed to achieve consensus on a recommendation. So if you have particular people on your committee that are either you feel as if they're blocking or they're not on board with some of the recommendations you're putting forth, or are rather don't really want to hear about the issue, but you still want to bring the issue forward for the employer to respond to. After you've had good discussion about the issue, you can then one of the worker co-chair can eventually just submit the recommendation to the employer. Now, recommendations. Attached with the letter that came out either this morning or yesterday with the link to this particular webinar, we provided you with a sample recommendation. And that sample recommendation you can use in your committee, and all you have to really do is kind of fill in the blanks. But that's what a typical recommendation will look like. It'll identify what the hazard is that you're discussing or whatever contravention of the act there are, and what are the remedies that you'd like to see to improve the situation in the workplace. So a recommendation. A joint health and safety or the health and safety representative has the power to put forth recommendations to the employer. And an employer who receives a recommendation has 21 days to respond. And the response must include a timetable to implement the recommendation, or if the recommendation is refused, an explanation justifying the rejection of the recommendation. So that is very important. Not only does it have to be in 21 days, but the response has to be in writing, either explaining why they're not going to go forward with the recommendation, or they provide a timetable when they're going to implement that. And it's always good to have on your recommendation, you provide them with a timetable which the committee feels is appropriate. And as mentioned, either co-chair has the power to put forth a recommendation unilaterally if, having brought the topic to the committee in good faith, failed to achieve consensus. Important, there is no obstruction of a committee member. So if you're sitting on a committee, no person shall hinder or interfere a committee member in the exercise of a power or performance of a duty under the Act. And you can find that in section 62. And it goes on to say that no person shall provide false information to a committee member in the exercise of a power or performance of a duty under the Act. This is very important because it is we talked about that internal responsibility system and what are the the key roles of the Joint Health and Safety Committee in identifying those hazards, obtaining information, and making recommendations, no person should be standing in your way to achieve those goals. If there's any kind of undue influence on the committee, then the IRS is not going to work, and the committee will not be functioning. And if there's any issues concerning obstruction of the committee, they can be brought up to the MOL. I'm going to turn it over to Felicia now, who's going to talk to us a little bit about due diligence.
Thanks, Paul. So as we've highlighted, IRS, the duties of the employer, supervisor, and worker. We've talked about the powers and duties of the committee. Now we're going to focus on due diligence and this very, very important piece, okay? So the general duty clause, I'm sure most of you has heard of it before, but we're going to spend some time just reviewing it. So the general duty clause can apply when there's no regulation that exists, but the reasonable care to protect a worker does exist. So the general duty clause is a broad responsibility of the employer and supervisors to ensure the health and safety, a worker, as well as other workers at or near the workplace that can be impacted by the employer's operation. In Ontario, under the clause 25(2)(h), it reads, an employer shall take every precaution reasonable in the circumstance to protect a worker. And similarly, under clause 27(2)(c), the supervisor has the same responsibility. This is really important for you folks to really jot down. You're going to get a copy of this presentation anyway, but to really understand that the general duty clause should not be viewed in a narrow way. It should be viewed in a broad, overarching principle when it comes to the employer's duty, and not that the employer should just take one or two precautions, but take every precaution that's reasonable in the circumstances to protect a worker. And later on, we're going to focus on more of the hierarchies of control and things that you folks can turn your mind to in terms of applying that. But an employer should not focus on, for example, just PPE and say, off you go, that's my every reasonable precaution to protect the worker reasonable in the circumstance, unless that is the only option. But as we know, there's many other avenues that you can take before we get to the PPE, as that's the last resort. And making sure that happens prior to accidents, illness, or injury, right, or death, right? I know most of you, from what I understand, have some level of screening happening in your workplace. So, for example, an employer is saying, well, you don't have to screen those people until somebody gets sick, and then 17 workers now are at home self-isolating because they're waiting back for their test, is not the employer taking every reasonable precaution in the circumstances, especially all the information that's out there around COVID. It's important of identifying and acquainting a worker with all hazards and sources of potential danger is the first step for an employer to establish their due diligence. And that means that the employer or supervisor has a duty to take every precaution reasonable in the circumstances to avoid both harm and an offense against the Occupational Health and Safety Act and any other regulations that are applicable. The exercise of due diligence should be done before anything's happening, right? So as we know, we always try and tackle any issue, particularly every issue in health and safety, from a proactive, not a reactive standpoint. And it cannot be considered due diligence if the health and safety measures are implemented after the accident, incident, injury, or occupational illness has occurred. Telling a worker to act safe in the workplace will not keep workers free from harm because the hazard still exists. And as we reviewed, the employer and the supervisor has many obligations in order to acquaint the worker in working safe and how to do that. And they have to they have to inform you and provide you the instructions in order for you to do your work safely, not act safely, right? We don't want it to be pointed back on the worker's behavior. Workers may make mistakes, can make mistakes, we all make mistakes, but if proper controls are in place, the impacts of exposure to a hazard, injury, or illness will be much less. To ensure compliance with 25(2)H, all hazards and risks of the work must be identified, assessed, and controlled. So precautionary principle. So keeping in mind what I just said, the precautionary principle means that taking prudent action in the face of potential serious risks without waiting for completion of further scientific research. You'll see that there's lots of discussion that's happening from QB National's perspective, from many of our other council unions as well, and labor movement's entirety, saying that we don't need to wait until it's proven scientifically on some of the things that are still lingering and questions about COVID-19, but rather why don't we take every reasonable precaution and do best practices moving forward that's going to protect our workers. And that's by looking back at history and seeing what has happened in the past and how to correct the errors of our ways. And I'm just going to read a quote for you folks from A. Campbell from the SARS Commission back in 2003. The point is not who is right and who is wrong about airborne transmission. The point is not science, but safety. Scientific knowledge changes constantly. When it comes to worker safety in hospitals or in your folks' sectors, we should not be driven by the scientific dogma of yesterday or even the scientific dogma of today. We should be driven by the precautionary principle that reasonable steps to reduce risks should not await scientific certainty. Until the precautionary principle is fully recognized, mandated, and enforced in Ontario hospital workers will continue to be at risk. And now I'm going to turn it back over to Paul, where we're going to talk about controlling hazards.
Thank you, Felicia. So bearing all those, the concept of due diligence in mind, we're going to turn our minds to how we can control the hazards in the workplace to ensure that if a worker is exposed to a hazard, what can we put in place to ensure that there is no accident, injury, or illness that will occur? So we have to think about what is a hazard. A hazard is any source of potential damage, harm, or adverse health effects on something or someone. And to protect workers from exposure to hazards, they must be first identified, properly assessed, and then adequately controlled. And as I've mentioned before, COVID-19 is a hazard in the workplace, just like any other. And like any other hazard, we have to look at finding out everything we know about it, ensure that all the controls that are in place are put in place. And even though it is a novel coronavirus, this is nothing new when it comes to protecting workers from infectious diseases. And we should not lose sight of what the basic principles are to protect workers from infectious diseases. To effectively control a hazard, it is important to understand the hazard. And the most common way is through a hazard assessment using the RACE principle, R-A-C-E. So the first step is to R, recognize the hazard, A is to assess the hazard, C, control the hazard, and E, evaluate the hazard. So R-A-C-E. When we talk about recognize, what we're talking about is identifying the hazards in the workplace, and you can do that through inspections, you can do that through surveys, hazard mapping, accident reports, your near-miss reports, test results, exposure reports, rates of occupational illness in the workplace. Once you've gathered that kind of information, you've identified that there is a hazard in the workplace, you need to assess it. What you mean by assess is you have to learn everything about the hazard, its source, train, if it doesn't require any kind of training. Are there policies, procedures, What is the current scientific knowledge? What is the precautionary principle? What does the research say? How many people will be affected in this workplace? What particular tasks make workers more susceptible to exposure? What are the best practices that are out there? And if a worker is exposed to the hazard, what are the health effects of a worker who will what are the health effects that will happen to the worker if they're exposed to that hazard? And all these things have to be taken into account before you can really apply a control. And the control means you apply the hierarchy of control, starting with controls that are at the source, along the path, and at the worker. And finally, once we've assessed that control and we put it in place, we have to constantly evaluate to determine, is this control protecting workers? So you have to start all over again by recognizing. You have to go through your action reports, go through your illness reports, and constantly be evaluating what is in place and is it protecting workers. So a hazard assessment is required before any new workplace policy, program, or processes or activities are introduced. And they should also be done before changes are introduced to existing policies, programs, processes, or activities, including when products, machinery, tools, or equipment change. And when hazards are identified or new information becomes available about existing hazards, we should then be doing an assessment. So as all of this new information is coming out, as we learn new processes, as we learn new equipment and programs related to COVID-19, are we constantly determining whether or not the controls in place are going to protect workers? When we come to controls, we have to think about, as mentioned before, at the source, along the path, and at the worker. And all occupational health and safety hazards can be controlled using the hierarchy of controls, where the most effective way to control a hazard is at the source through elimination or substitution. And if it is not possible to eliminate the hazard, the next step is along the path using engineering and administrative controls. And the next step is at the worker using personal protective equipment. And this is the least desirable manner to control a hazard. There's been a lot of talk, as you know, about what is an appropriate respiratory protection. Is it the surgical mask, N95 respirator? We just want to remind you, though, that that is at the bottom, and that is the least effective way to protect a worker. So if we're currently are not provided a sufficient or appropriate level of protective equipment, we need to also consider what other things can be put in place so that the impact to workers is protected along the path. So now we're going to apply the hierarchy of controls. We're going to go through the RACE principle, and I think Felicia is going to lead us off, and we're going to try and just go through a scenario of how you can apply these principles in the workplace as it relates to COVID-19.
Thanks, Paul. So starting with the first letter, R, so recognize. So you need to identify what are the hazards of COVID-19 and where is the exposure happening in your workplace. So what are the hazards of COVID-19? Can be transmission, right? Obviously, we know that it's an occupational illness that comes with it. And really looking at how does that hazard apply within your workplace and where that exposure is and identifying that. So some of you folks that are going and doing home care, your level of risk may significantly increase depending on if that home care that you're providing to that particular client has COVID-19 and you have to provide it. You can't not go to the home and provide the assistance that they require, right? Or if you have a co-living situation or a shelter where you know that there's positive folks that are living within the home or the group home, for example, and what's the level of exposure for someone that's doing one-on-one care, someone that's providing the food, maybe someone that has a secondary exposure risk, looking at that and recognizing it and identifying it. Looking at monthly inspections, we are encouraging folks to continue to do your inspections on a monthly basis as per the Act. conduct surveys with your membership, and hopefully that's in consultation with the Joint Health and Safety Committee from both sides. But sometimes we have to be proactive and creative in doing things just from the union side. Looking at floor plans or spaces. So maybe it's not a floor plan in a group home, but maybe you work in a vehicle. So looking at that particular vehicle and understanding that you've already identified the hazards of COVID and how it could be transmitted, and how the risk of exposure may happen. So looking at that piece, or again, looking at a typical floor plan, which would be in a facility setting. Looking at near-miss reports, hopefully folks are filling that out. And when we say near-miss reports in this context, it would probably be tox or exposure reports that could happen. Or if you have a different process within your workplace, it still can be called near-miss reports. Accidents and illness notices that we did highlight that if you do fill out a tox or exposure form or WSIB form, you would get those notices, but just WSIB forms as well. That's something that hopefully you folks can get. And when before I move on in terms of the types of sources of how to collect and recognize this information, another one is mapping, right? Mapping out where are people working, who is coming in and out of the building, the frequency, the volume, of folks in a particular area. And you may find out, you know what, that area actually has 17 workers. That is a high risk because there's 3 folks that are already suspected with COVID, or maybe 2 are already confirmed, right? So really recognizing and understanding that piece when you're working through applying the hierarchies of control and looking at the race principle. Identifying workers and tasks and where they're likely exposure to COVID-19. So I think I just already covered that point earlier. So just turning your minds to those 3 points in terms of recognizing. Assessments. So review new or existing policies, protocols, training programs related to IPAC. So I hope that all of you have a pandemic plan that is updated and ongoing. We want to stress that point. As we said earlier, you know, everything is changing quite quickly and frequently when you look at the public health guidelines and ministry guidelines that they're putting out. Those are updating probably on a daily basis, definitely a weekly basis. So it's important for your employer that have pandemic plans and should have pandemic plans that they should not have not been updated since, say, March 17th, right? That's unacceptable, and you should definitely push and take a look at that. And really understanding that, is this pandemic plan actually protecting workers? If you have a pandemic plan in your workplace and people are frequently getting sick and the hazard is not being controlled, it's probably not working. Infection control plans. Considering the type of work that you folks do, biological hazards is nothing new. So there should be some level of an infection control plan that's through the occupational health and safety policies. And looking, has that been updated to reflect COVID-19's biological hazard? And what does that look like? And making sure that you know, the Joint Health and Safety Committee is involved in that and in this consultation with that. Measures and procedures to protect workers from exposure to COVID-19. So really looking back at the hierarchies of control that Paul went through, and looking at, is there engineering controls, administrative controls, and then at the last resort, PPE, to put in measures and procedures to protect the worker. So a good example could be that if you have to use vehicles, for example, to do the work that you do, that if you usually have a buddy system, that you folks drive in separate vehicles, right? That there is a cleaning process that happens to that vehicle before and after you're done work. And if it's absolutely necessary that you have to be in a vehicle, then you try and, you know, do social distancing, which we know as the length of a car is not possible, but one sit in the back, one sit in the front diagonal, you know, PPE, things like that. Training. So all workers familiar with routine practices and additional precautions to avoid exposure to COVID-19. It's very important that training is a key piece. If you don't have training, you don't know what you're doing, and you're not getting the proper instructions and information in order to do your work in a safe way, which should be trickled down from the employer supervisor to you folks. And training could be, that leads into the next point, for protective equipment in terms of donning and doffing. It could be training on how to properly clean and disinfect certain areas, what type of chemicals are you using, how to use those chemicals safely. Protective PPE, personal protective equipment, so fit testing, making sure that's happening, training, making sure that they have training records, and making sure that the training is adequate as well, and that supply, right? I know that that's been a hot topic for everyone in terms of shortages of supply, but really inserting yourself and trying to have that communication with the employer to see, well, what does our supply look like, and what are we going to do once it starts to run low? What are the measures that we're going to put in place so we don't have to just rely on PPE? And legislation. What does the Act and regulations say, and how do we achieve compliance, right? As we said earlier, the Act has not changed. There are certain emergency orders and directives that's come out, but health and safety is still the same. So how can we look to that and apply the legislation in our assessment, and how can we also look at other ministry guidelines and guidance notes that has come out from public health and apply that, and how do we achieve that as well? I'm going to turn it back over to Paul to finish off on our last two letters.
Okay, so we're going to get caught up to control now, and we talk about elimination. Elimination can happen if you are if we ensure that COVID-19 is eliminated from the workplace, that it never ever gets into the workplace. It is a form of elimination, or people that work at home is a form of elimination. You will also note that if you're required to work or provide care with people with COVID-19, it's impossible to eliminate that hazard. When we talk about substitution, we can look at whatever particular products we're using in the workplace to clean or disinfect, or if we work with other biological hazards in the workplace, can they be substituted for products that do not create a hazard? That's just an example of a substitution of a hazard. When we look at engineering controls, we're looking at isolating the hazard or designing equipment and processes to reduce the source of exposure. And that can be done through physical barriers, machinery guards, and equipment design. We have to look at ventilation. And we want to ensure that we have good ventilation in our workplaces if we're providing care to people with COVID-19. But just on a general basis, we should always have good ventilation. And that can be done through either general, local, or natural ventilation systems. Screening of clients, patients, students before entry to the workplace. So do we have an effective process in place to ensure that both staff and clients are screened prior to providing care or to provide service to our clients? Are we limiting the workplace? Are we limiting the single points of access to the workplace to one point of entry? Are we limiting suspected or confirmed cases to isolated areas of the workplace? So if you do have people in your workplace, are we isolating them? If we have multiple residents or clients who have COVID-19, is there a possibility to cohort them in one area of the workplace? Are we isolating them or keeping them in their rooms, or in not allowing them to walk all around all over the workplace and potentially expose not only other residents and clients, but workers as well? And I realize these are very general notes, but it is you, members of the Joint Health and Safety Committee, who need to be out there in the workplace and identifying what are the best sources of these kinds of controls. Administrative controls include, it's basically changing the way people work. And we'd rather have things changed before us rather than us be working around that hazard. But it is a means of control. So that we have to look at whatever training policy is in place right now. Is it effective? is it protecting workers? I saw a comment just pop up there a few minutes ago. Someone asked, is a YouTube video for PPE like good training? I'm not the person to evaluate that. That is the Joint Health and Safety Committee's job to determine if the workers that are watching this video, at the end of the day, are they able to protect themselves? Are people still being exposed or being exposed to infectious diseases having watched that YouTube video? Are you surveying people? Did they grasp knowledge? Do they understand what they've learned in that video? These are some of the questions that have to be answered because there's no standards around these things. The only standard is, are workers protected at the end of the day? Look at policies, programs, and standard operating procedures. Self-monitoring is an administrative control, and so is shift work if it is possible. You can stagger those shifts. You can have social distancing or physical distancing in the workplace and have staggered break times in a lunchroom to ensure that not all workers are in the lunchroom at the same time. And like I said, this is going to be dependent on whatever workplace you have and if this is possible. And to be really creative and figure out what are the best ways so that we can reduce that exposure and still enforce that physical distancing that is so important for prevention to exposure to COVID-19. And hand hygiene, cough etiquette, and maybe having a washroom that's designated only for staff is our ideas of administrative controls. So personal protective equipment is the last resort. And if PPE is required to be worn, it should be used when hazards can't be eliminated or completely controlled by engineering or administrative controls. And obviously, if you are going to provide care or provide service to a person with COVID-19 or a suspected case, or to anyone who has not been screened for COVID-19, you should be wearing PPE, which includes at least, hopefully, an N95 respirator and gloves as well. And for some of you, you will be required to wearing the face shield and the gown as well. Training. When it comes to PPE, what is the use and care and limitations of the PPE that you're required to wear? And have the workers received training on how to put it on and take it off safely? Have they done a fit testing if they are required to wear N95 respirators? Can workers do a series of tasks wearing that PPE without experiencing discomfort or heat? Is the PPE clean or stored in a convenient place and does not create other hazards? And at the end, evaluate to ensure that these controls protect workers. So we're running a little bit late, so I'm just gonna show you some of the resources that are available for COVID-19 and for just occupational health and safety, and this will be included in the presentation. And we'll try and get a copy of the presentation to everyone that has joined us today. If not, it will be posted on the QP Ontario website in the very near future. So we're going to take questions now. We still have a few more minutes for questions. And just a reminder that we want to keep the questions as general to the sector as possible. And if you have specific work-related issues that you'd like to address, you're welcome to bring it up with your local executive. And if they don't have the answer for you, of course, you can reach out to your national representative who can assist you with those particular workplace questions.
Okay, so we're going to take our first question. While it's a little specific, but I think it's general enough that we can at least give some advice on. So it's from Dan Mallet. Sorry if I'm pronouncing anyone's name wrong. I apologize from now. We are having a disagreement with employers of whether just being at work with others seemingly healthy during a pandemic is or is not a hazard that needs to be controlled. Thoughts on this? So I would say that definitely does need to be controlled and needs to be addressed, and there needs to be a plan in place. As we know, there are folks that while they seem healthy, they could be asymptomatic and still be spreading and transmitting the COVID-19 to other seemingly healthy folks. So I don't think that that's something that should be ignored or considered not a hazard. So I would definitely encourage you to speak with your employer to turn their minds to. There's lots of documentation that states that folks can not only be symptomatic but asymptomatic and show zero symptoms and still transmit it. Paul, did you want to add anything? Sorry, I thought I heard something.
No, that's right. I mean, it's
Right.
If you're having any kind of disagreement, you really have to evaluate where is that risk. And we don't usually like to use the word risk, but what is the likelihood of exposure? And that
Yeah.
seems to be a bar that the Ministry of Labor seems to use a lot is, are workers likely to be exposed? And will this exposure, is it great enough that the worker will be will be exposed to COVID-19?
Hmm.
And if you have any debates on this and you believe that the employer is just not putting in the sufficient kind of controls, you can try to the MOL. Right now, it's very difficult that the MOL is not writing orders, but we
Hmm.
can look at if you get a field visit report from an inspector, you can pass that along to your national representative, and we will look at it to determine whether or not we feel as if continues to be a contravention of the act, and we can appeal the lack of orders in that situation.
Hmm. From Missy, we have, how is COVID-19 a near miss? That's a good
Yeah.
question. I actually had to
well,
think about that for
well,
a
no,
little
we
bit.
were the whole point of that. We're just trying to give you an examples of what
Yeah.
the race principle looks like, and so we want you to think about this not only in COVID-19, but the race principle can apply to multiple different situations and hazards in the
Yes.
workplace. So there is no near miss when it comes to infectious diseases,
No.
especially. But if there are people that are filling out exposure forms, as we learned earlier, you can obtain a report.
Hmm.
But if the employer is in possession of a report of occupational health and safety, say they have a list of a number of workers who filled out exposure forms, that'd be some kind of information that I would want to know.
Of
It
course.
would definitely explain that or expose the fact that whatever controls are in place are just not protecting workers.
So we have another question from Aaron F. Should we all be wearing face masks, understanding that the virus can be aerosoled?
This is the debate we're having, and I would just say that it's a case by case basis. We're asking that the precautionary principle be applied in this situation. That we'd want workers that are in a situation where they are going to be providing care to people with suspected or confirmed cases, or in situations where you're going to be in close contact with people who haven't been screened, that sneezes, and as to the debate whether or not the disease can be airborne, we're not going to get into that debate in this particular webinar, but we want to ensure that you have proper respiratory infection in the circumstance. And what that is will be dependent on a case-by-case situation.
Great. So I think Robin's question is related to Aaron F's question. So we'll move on to the next one. Sorry, I'm just scrolling. Oh, Paul answered that one in terms of, is a YouTube video considered proper training on PPE? We have a comment that I read, reports on aerosol can travel further than 2 meters, and a sneeze can travel half the length of a football field. So I think Paul kind of addressed that. We don't want to get into a debate. Is there a copy of the survey for staff returning from self-isolation that we could get as we go ahead to return to work? Just something that staff can voice their concerns. I certainly don't see why not. I think that's definitely a measure that you folks can suggest as Joint Health and Safety Committee reps and committees and as health and safety reps. There should be, though, there is testing and clearance when folks have been self-isolating or quarantining as a result of having COVID, or if they had to self-isolate because they came in contact with a high-risk person. So there are guidelines out there that does address that. Okay, Robin, I think, Paul, should we take a few more? Or?
Yeah, we have a couple.
Yeah, okay, right. In a daycare setting, I assume that the only protection would be a mask, but isn't it unsafe to wear a mask all day as well? And that children that are won't wear a mask, so it doesn't really protect us?
So a lot of questions, we have a lot of questions around this, and we wanted you to be able to work in the workplace without having to wear personal protective equipment. And remember that it is a last resort, and we all know that children are in a daycare setting are not going to be able to tolerate a mask all day. So we have to look strongly at whatever kind of screening policy or procedure we have is effective. Are we screening during the day? Are we limiting the number of people in the daycare to a level that is safe so that we don't have so many people, or that exposure is reduced? And we are not advocating in this particular situation that workers have to be in a situation where they're required to wear a mask all day, because it's just not comfortable and it's just not appropriate. So we have to look at what is our screening policy, and what does it look like? And how effective is it? I'm just going to leave it at that.
Okay. So we have a question from Janet. Our members work child care centers. Can health and safety reps make recommendations for policies, procedures, PPE use if these are above public health and safety and ministry requirements? Absolutely, you can. That is a power that you folks have, that you can make a unilateral recommendation. Granted, you have to understand that does take it does allow the employer to have 21 days to respond. So you might want to be creative and try to write a letter that highlights recommendations, maybe put in one as a letter, one as a formal, so that way you can try and see if you can get a response back more swiftly rather than waiting for 21 days, because that's a long time in this era. Okay, I think we'll take a couple more, Paul, or
Yep.
Yep, okay.
This next one's easy.
Oh, Maurice, I know you can use N95 masks that expire, but ours are 5+ years expired. Oh dear. Is this reasonable to use?
A lot of the debates around the expiry has to do with the elastic, and generally the filtration piece does not degrade over time. What you want to do is just ensure that if you are required to wear an N95 respirator, you're required to examine it before you use it. So first of all, make sure you use all the ones that are not expired first. But if you're required to use an expired one, check the elastic, because that's the first thing to degrade an N95 respirator. So check that elastic, make sure that when you put it on, there's no damage to the filter piece, that you can still do your seal check. And if you can still do your seal check, you should be able to go on, and it should be an appropriate level of protection if there are no unexpired ones in the workplace.
Great, thank you. So Jessica says, if we have volunteers that do transportation, should they put on a mask? Should they put a mask?
Yes.
Yes.
First of all, you want to go through the screening.
Yes.
And if you're we want to make sure that your transportation has barriers. You want to make sure that you have a 2 meter a greater than 2 meters separation, that there's ongoing cleaning and disinfecting of the vehicle, and that there's good ventilation, that there's if possible, we're asking that the windows be down as well. Those are some of the administrative controls that can go along in addition to them wearing masks and yourself wearing a mask as well.
So we have one from Janice. In childcare setting, what kind of masks should be worn?
The greatest amount of respiratory protection available.
Another one from Janet. How do health and safety policies and legislation regulations conflicts get resolved, i.e., in childcare we usually have age-related groups, but family groupings are safer, as families with children in different ages would contact only one staff rather than several.
That is a creative way to do to have administrative controls, and if that is going to reduce the intermingling of staff with what we're trying to do is just reduce that intermingling and that and having staff exposed to a greater number of individuals in the workplace. And that, like, that is a creative way of applying administrative controls to ensure that the workers do not come into contact with a wide range, a wide exposure of workers. Limit them to just one room and have it be the same people on a day-in, day basis. But that is a very creative way of doing particular administrative controls.
So we have two more, and I think, well, one's a comment, looks like one's a question. So, hi, speaking on behalf of some of our workers who are 60 and over, returning to the daycare center, should there be some protocol put in place to protect, oh, sorry, it just moved, where are we? To protect our vulnerable community. Thank you, Grace. Yes, there definitely it should be, if they're returning to work, there should be protocols that are put into place in order to protect the vulnerable folks. As we know, there's certain criteria that the ministry has established, guidelines from public health that establish folks that are at higher risk. So that should be put in place, and I would encourage you to talk to your staff rep on what does that look like, as they would have that information to help you carry out and to make those recommendations on what that protocol should look like. I read that the ministry, Janet, I read that the ministry inspectors are not upholding work refusals. What happens when an employee feels working is unsafe and does work refusals, but it's not upheld by an inspector?
So in that situation, you would reach out to your Joint Health and Safety Committee member who did the investigation with you, and to contact your local as well and forward them forward the field visit report to your local, and they can forward to the national rep to evaluate whether or not these are reasonable grounds for an appeal to the work refusal. And like I said, that'll be on a case-by-case basis.
So thank you, folks, for your time. And I do see there are two last questions, but we do have to end for today. We will get back to your staff reps with those questions so they can follow up with you, because we do have your emails and your contact. So thank you.